Very good morning to all. At the outset, none of the authors have any financial disclosures pertaining to this study, which I'm going to present. So, keratoconus is an inflammatory progressive corneal disease characterized by corneal steepening and thinning, and the incidence of keratoconus in India is now 20% in the population, what we see, which leads to blur vision due to irregular astigmatism and defective stereopsis, which does affect the poor quality of vision and the binocular vision anomalies, which does affect the patient mindset also. Now, we do have treatment like corneal collagen cross-linking in early cases and corneal transplant in advanced cases. However, the outcomes sometimes are not up to the mark with progression of the keratoconus disease, corneal haze post cross-linking, excessive flattening of keratoconus leading to vision abnormalities and graft failure. And this can affect the visual quality of the patients, and sometimes the post-crosslinking outcomes may fail. Now, the challenges faced in keratoconus management is that we have to have an invasive procedure at this point of time, which can be expensive. There can be paucity of grafts and also emotionally burdensome, especially in children. So now if we look at the keratoconus definition, it is progressive, and traditionally it was non-inflammatory, but with increasing reports, it has been suggested now that there is a low-grade chronic inflammation and oxidative stress, which may play a key role in the pathogenesis of the disease, leading to stromal thinning and affecting the vision of the patient. And whenever there is inflammation and we don't treat the inflammation, the collagen which is there in the corneal bundles, it starts getting degraded, and there is progressive loss of this collagen bundles, which leads to progression of the disease and thinning of the cornea. So the key here is inflammation for this disease. So now the time has come to treat the root cause, and trehalose plays a very important role because it promotes the autophagy and reduces the oxidative stress due to inflammation in the cells for this patient. So what we did was we started with the HC cell line test. This was done in the lab on the corneal epithelial cell lines, where you can see when we inject the trehalose on the desiccation stress model, these are the cells which are stressed, and these are how the healthy cells should look like. When we treat the cell lines with 6 hours of trehalose, the cells start coming back to life, which you can see here with just 6 hours of treatment. And also, when we did the corneal stromal test with the corneal fibroblast, you can see in the inflammation there is absence of totally red color, which is the lysyl oxidase. And when you treat the inflammation with trehalose, you can see that the red color is coming back, which is again the lysyl oxidase and the collagen fibers, which is coming. So our question was, can the non-invasive collagen modulation decrease the need of a surgical intervention? So we took 540 patients. We did entire diagnostics to see whether it is normal or not, and one group was treated with placebo with 180 eyes, the second group with trehalose, and the third group with trehalose and cyclosporin. And this is how we randomized and planned the treatment accordingly. Now, the group which got the placebo treatment, in that group, 74% of the patients progressed. The group which got trehalose patients, only 12% progressed, and the group which got trehalose plus cyclosporin, only 6.6% of the patients progressed. And this is just with the treatment of drops. You can see that you can see a flattening in the cornea without any cross-linking, which does show the effect that the drops can act as good as the cross-linking itself. And you can see the stabilization and flattening on Kmax and K-mean value also. And
where
the TCT
where is the timer? Actually, we need the timer. Because presentation from laptop is not allowed in free paper session.
Ma'am, I have uploaded, but it's not come.
Okay, thank you very much. Your time is over.